Some people scream, some people use bad words. You're a laugher, so.
Yeah, I just gotta laugh through the
You'll laugh through the pain. Tell me a little bit about what's going on, when it started, all those kinds of things.
Yeah, so I was in a car accident probably about 5 years ago, kind of a rear-ended situation, so definitely had a lot of whiplash. I had seen a chiropractor for probably about 2 months, and you know, my neck and back pain had improved, but I've definitely lately noticed just a lot of tension in my upper shoulders, neck, trap area, and I do a lot of weight training, and I love to do bar squats and things like that, but I've kind of just avoided those because I feel like it's putting a lot of pressure on that area. And anytime I kind of turn my neck side to side, I definitely feel like a lot of like popping, discomfort, not really a lot of pain, but
so it's not painful when it pops, you just kind of feel like there's something in there that's not wanting to move with you when you do it.
Exactly, yes.
That makes sense. Anything else going on with the squats, or is it mostly just neck pain, no back pain?
Mostly neck pain. My lower back has been pretty good. I've been doing a lot of deadlifts, so it's kind of been strengthening like my lower back area. Just definitely a lot of concern with the upper.
Okay, awesome. Well, let's go through watching your movement. So we do selective functional movement assessment, which kind of evaluates whole body, see how it moves, and see what could be causing any of the issues that you're having. Start with your feet together. You're just going to very side. You're just going to look down and touch your chin to your chest. And any pain you have with any of these movements, let me know. Come back up. And any pain you have with any of these movements, let me know. Did you notice anything with that?
No pain, just kind of tight.
Okay. Now I'm going to have you do looking up at the sky, looking back, as far back as you can. Okay. That's good. Anything with that?
No, that one was good. Didn't really feel any tension or anything like that.
Movement looked good. So it's probably muscular tension on the back when you look forwards, if that's all you're really feeling. Now just turn your head side to side as far as you can. Okay. Good. Any tension pulling with that?
Just a little on kind of the sides, kind of a little popping. I was mentioning.
Okay. Next we're going to do an upper extremity pattern. So you're going to take whichever arm you want to start with, reach over behind your back and try to touch the opposite shoulder blade.
Okay.
Good. Other side. Good. Both those look good.
Awesome.
Now you're going to bring it behind your back and try to touch the underside of your
shoulder.
Good. Nice. Okay. Very good. All right. Those look good. Let's go ahead and feet together. You're going to bend forward and touch your toes. A little hamstring tightness, but not too bad. Come on up. That feel okay?
Yeah, I definitely feel. I had leg day the other day, so a little tight hammies. But
everything looks good except for the knees bending towards the end of it. So that's usually just hamstring tightness going on. Arms up to the sky, and then bend backwards. Okay. Good. How's that feel?
Pretty good. I didn't really feel any tension or pain.
Pretty good. Now we're going to do the same. I'm just going to turn. As far as you can each way. Okay. Good. There's a little tightness in front of the hips, but most people have that just from sitting and so it's really good. Next, we're going to balance on one leg. So you're just going to stand here and just balance just like this. And try to hold it for 10 seconds. Pretty good. Okay. Pretty solid. You can switch.
Sweet. Now it's good on this side.
Equilibrium's off as I switch. That's good. Now you're sitting out, so pretty good. Okay, you relax. Notice a little bit flat arches or things like that.
I have super flat feet.
Yeah, I can notice the ankle rolling in just a little bit there. Single leg stance, when you notice the kind of ankles wanting to roll in a little bit while you're doing it, that's just usually when it comes to either tightness on the outside of the calf or flat arches. So like you were saying, if you have really flat feet, that's what we attribute that to. Last one, spread your feet apart. We're going to have arms up to the sky first. We're going to try to do a squat.
All right.
Down as you go. Okay. Now bring the arms out in front of you and try it again. Okay. So a little bit lower there. So we have some tightness in the lats. Alright, so for this, with the not being able to squat super low, we'll come out here and test it with your heels elevated so that way we can see if what's stopping you from squatting all the way low is ankle mobility or if it's when you give the ankle more room to move, it's easier to do that. So we're gonna go ahead and stand up there with the heels elevated.
You can only crash force someone so often, right? Until they can figure it out, you know?
Okay.
So
Try this with the arms up. Okay,
That's crazy.
there, now we know. So ankles are definitely involved as well. So when you talk about the popping and stuff that you notice, is it up here or more down here?
Up there.
More up here.
Yeah. Yep.
And that's where it kind of hurts slash pops.
Slash also, I feel like I'm kind of looking at like an up angle almost. Like,
It's very crunched together, that's for sure.
yeah. I hear and feel the crunch.
I feel the crunch too.
Yeah.
The medical term.
Oh,
Alright.
yeah, that area is not so great.
Yeah, I feel a little swelling in here as well.
Mm-hmm.
Not a cause for alarm or anything, but
That's
kind of
good.
feels like ketchup packet.
Yeah.
Like to tell us. Or what they taught us in school is that edema in the spine feels like a ketchup packet, and it's oddly how much it does. Alright. Now I'm just gonna check a little movement here. So just kind of like. Yeah, so.
You know
Supposed to
exactly what's
glide.
happening.
This one's supposed to glide. This one does a little bit, but not as much. Okay? Alright. And the trap.
Also worked them out yesterday, so they're a little sore.
Okay, let's go ahead. Most of your neck musculature does not feel tight to me. I mean,
That's
I'm not
good.
saying that it's not, but that's a
Yeah.
good thing. So it's more so spine related.
Mm.
Okay. We'll go ahead and go through these though. Have you ever had active release technique done on you before?
Nope.
Okay. Well, it's soft tissue therapy, kind of made to make muscles move the way they're supposed to, but by actively releasing them. Pin. It's not very enjoyable sometimes.
Yeah, I definitely feel like the ticklishness.
Yeah, it's kind of like a weave. It's not a pin and stretch, but you're holding the muscle down, putting tension in the way that you want it, the muscle fibers to be able to move, I guess, in a healthy way. Probably not explaining that very well, but
Kind of like back on track, basically.
yeah, kind of trying to realign and reprogram the muscle to realize which way it's supposed to move. So see, yours doesn't want to move
No.
in this
Fighting
direction
it.
at all. So we're gonna kind of slowly tension the other way, and then move the head through the range of motion. Is that not fun?
Yeah. It's feeling a little more relaxed though, so that's good.
It's funny. It works to an extent immediately, but over the next 2 to 3 days, it kind of will continue to work or continue to feel better. Which a lot of people will notice. Like the first day they're in here, they're like, "Well, kind of helped," and then after they come in after a week, it's like, "I feel great." So it's kind of cool how that works.
Yeah. You're definitely hitting whatever pressure point it's irritated by. I can feel it.
Yours is some of your trap, but it's also your levator scap. And a lot of people think when they have this big knot right here, that it's just a knot in their trap. But
Yeah,
actually
that's what
where
I'm
the
thinking.
trap and the levator scap cross. So the levator scap is a skinny little muscle, but it crosses right under the trap, and that's this little point here.
Gotcha.
That everybody's like, I got a huge knot, and it's kind of both of those muscles being tense, but where they cross is the real problem, so they kind of get stuck together. And the two muscles, you stretch them halfway the same way. So you would look down to stretch. You notice how your shoulders kind of come up when you look down? That is why I know levator scap and trap, but levator scap is involved because your levator scap comes up here and it attaches to the top of your shoulder blades. So your shoulder blades are following your neck as soon as you look forwards every time. When you look up, when you look back up, they relax. Then when you look forwards, your
They
shoulders
kind of move with
follow.
it
Yeah.
versus like being back here, I guess, and kind of.
They just kind of, our goal is to have our shoulder blades back and down, not necessarily jam back together, but just down. and you just cannot stay down and you look forwards.
Mm-hmm.
You can't.
Yeah, I'm
Well,
like
if-
constantly correcting my posture when I'm standing because I notice I'll start going like this if I'm like looking down, so I'll like overcorrect kind of to like.
Next time when you're doing it, think about, instead of thinking about pulling them together, I want you to think just pushing them down. So
Okay.
just back down instead of like pulling them up here, because that's still kind of contracting the muscles a little bit
Gotcha.
when you pull them up, because that's part of the levator scap's job. It elevates the scapula.
Okay.
It's weird how all these muscles have what they do in their name sometimes.
That helps when there's so many.
Yeah.
I forget which one.
Oh yeah. Especially in the hands and the feet.
Oh yeah. A lot of tendons there.
A whole bunch going on.
Yeah, one time I had a sports evaluation probably like 5 or 6 years ago, and they kept telling me that my right shoulder was like higher than my left shoulder, and I think I've just had that problem for like forever.
Yeah, are you right hand dominant?
Mm-hmm.
Probably just from, a lot of people are that way, I'm that way as well.
Kind of just whatever side you work the most.
Yeah, the muscles kind of get overdeveloped, or you just get used to doing things with that arm. So it's just, it's not necessarily a bad thing unless it's painful
Yeah.
to you. A lot of things, if they're not painful, I'm like, well, we're not gonna mess with it right now.
Yeah, because it might,
Yeah.
make
We
it
don't
painful.
we don't wanna make whatever's painful. If it's working, then good.
Definitely. Okay, I'm just getting a lot of soreness, but that makes sense. That this has like always been my problem area.
Yeah.
So makes sense.
Mm-hmm.
Are there any like exercises I should like avoid maybe, or maybe even that would help?
Yes, there are. We will get to that.
Skipping ahead. Sorry.
After this, I'll show you a couple stretches and exercises to kind of help you train to keep, like, whenever you warm up for exercising or anything like that, which it's also something you would do every day, but it's good when you're warming up to kind of retrain your body to where it keeps the shoulder blades down naturally. Another thing I want to kind of test when it relates to when we have scapular problems like that, so put your hand in a fist like this, and I want you to punch up towards the ceiling against resistance here. Okay, strong on that side. Let's try this one. So straight up and punch. Good. So then that's not it. Serratus anterior is a muscle, that's what that action does, but it also keeps your scapulas glued to your rib cage.
Okay.
So that's kind of how we test to see if that's what's weak and making the scapula kind of flare around and do crazy stuff. But
Gosh, see which angle it's
not.
kind of
Yeah.
from. Yeah.
Another thing we could test to kind of find out, it can come from that serratus anterior being weak and it letting the scapulas flare out, or you having a weak, deep cervical neck flexors, which is making this have to hold your head up all the time. So we can also test that. I'm gonna have you tuck your chin, okay, a little bit less, perfect. And now I'm gonna have you lift your head off the table just this much. See how we kind of gradually, your chin's coming out, and it kind of feels, that feel hard to you?
A little bit.
Okay, come back down. Tuck again. Perfect. Now lift and hold. Yeah.
A little bit of strain.
A little strain, yeah.
Yeah.
So that's probably more so what the cause, because when your deep cervical neck flexors get weak, which most people's are, it's like an upper cross syndrome kind of thing. It's kind of like this isn't holding your head up all the time, and whenever you're doing things, they're not strong enough to support your neck and your head. So your trap and levator scap, that all attach at the top of your head, or at the bottom of your skull, but the top of your neck is what's holding your head up all the time. So they just continuously getting tense. So that's probably more so what's going on.
I wonder if like looking down like at your phone kind of thing
Yes.
weakens that area.
It does.
Yeah.
Definitely does.
That's definitely like a sensitive area. Yeah.
4 tiny little muscles in here. They're suboccipital muscles. And when they get tight, they can cause a lot of issues that you're talking about. And they kind of, when you're saying it feels like you're always kind of looking up. When those are tight, they kind of push your chin out like that, and they jam the back of your head together.
Yeah.
Not the whole back of your head, but you're just
Kind of that
C1,
upper,
C2,
yeah.
and occiput, yeah. They also cause headaches. Do you have any headaches? Okay,
For sure.
that makes a little bit of sense then.
Yeah.
they're all the trigger points in these muscles referral patterns, which are kind of like just a referred pain when they're tight or irritated, mimic like headaches that come around here, anything like that. Is that how
Yeah,
yours are?
kind of like a
kinda?
tension headache.
Yeah,
for
exactly.
sure. Definitely more towards like the end of the day too, so that makes sense. So like
Mhm.
straining from the day kind of thing.
Mhm. Try to relax. You also have very tight SCMs in the front of your neck. So sternocleidomastoid muscles, they are these big guys right here, this chunky piece.
The one that kind of like.
Yeah.
Yeah.
They attach right up here and go right down to your sternum. But yours are extremely unhappy.
How do we cheer them up?
A little bit more, I'll give you a stretch for that too. Start taking notes because we got a lot. Alright, tuck your chin for me.
Yeah, that's a good one.
I haven't even released SCM yet, so that's gonna be fun.
Oh,
Might need to do that too. So it'll stop trying to overpower me in here. A lot of times when it's tight and it kind of feels like the patient won't let you hold their head.
Yeah, that's the thing.
And it's
Problem.
nice.
Even when I'm trying, it's still
Yeah,
just
it's like you
fighting
can't
it.
help it. There's literally nothing that you can do.
That makes you feel better.
Yeah, no,
Yeah,
that's kind of like a cue that like they can't if you have to tell them a couple times.
I heard a pop. That was good.
Yes, that's good, Pop. That means
Yeah.
things are moving that weren't able to move.
It wasn't like the pop from before.
Yeah. And a lot of it could be that because all these muscles attach to places that are right around or on the place that you're saying keeps popping.
That makes sense.
And it could be that these muscles are so tight that they're pulling it out of where it wants to be. And not that the pops are a bad thing, but it's kind of like a sign that it keeps moving around.
Yeah.
Alright, so we're gonna do some adjusting. Alright, so now with your eyes, I want you to look up and to the right. Take a big deep breath in. And all the way out. Relax. We're gonna let you breathe for a sec. You were really tense and I didn't want to thrust through it.
No,
So
you're
relax.
good. This kind of freaks me out, I feel like.
We can do it other ways. Good? Okay. Do one more time, and if not, then we'll. Alright, look up and to the right with your eyes. Okay. Yours are pretty crunched together, they're not gonna make the big kaboom. But this whole left side is pretty locked up. We'll go a little lower.
Same thing?
And just breathe. Wiggle your toes.
That was a big snap.
Yeah, you're one of the ones where we have to give 85 different things to distract you, and
Yeah.
then you will relax.
It's funny, I'm like super easily distracted, but when I don't want to be distracted, it's impossible to distract me.
Now we'll go a little lower on this right side, because the lower part over here is a little worse.
Yeah, definitely. Yeah, that one was, yeah.
Yeah, got a little tension here. Alright. Big deep breath in. And all the way down. A little bit. There we go. That one's locking up.
Yeah.
Now let's do
It's
that
one of those
again.
I gotta fight it things.
Yeah. A little better.
Yeah.
Kept those are pretty snug in there. Feel some tension in the front of your legs on this. I think you might have extremely tight quads.
You know, that's probably accurate.
Yeah. Calves are okay, so we're gonna do this since we saw our.
Oh man.
Yeah, that's really rough.
Yeah, that's pretty bad.
So this was making your squat.
Ooh.
This is a part of it not being enjoyable sometimes. Promise it helps. Work through the pain.
Yeah, no pain, no gain.
This was part of the reason your squat went down a lot further when we put your heels on that.
So what'd you say was going on with that area? So the ankle mobility.
Ankle mobility, a lot of times, yeah, when your calves are super tight, they'll just restrict your ankle from the back. So we're gonna check out the front once we turn you around. But clearly we have some things happening here. Yeah. Clearly we got a couple things going on.
That was the ankle I was saying. It's been like very messed up my whole life anyway, so that's probably just thrown everything off like for a long time. But
Everybody has one of those ankles, I think.
It was better for a few years, and then I decided to run cross country and screwed it up. So yeah, too many ankle rolls.
That'll do it.
I do not run anymore, so that's good at least.
Yeah.
This side isn't as bad as the other one. I mean, I still feel it a lot, but the other one was like excruciating.
And it's mostly the outsides of your calves that are the worst part.
Mhm.
So we'll do some of those when you're flipped over. I'm gonna have you flip on your back now. Yeah.
Yeah. Super tight. I always get pain right in there in my feet.
And a lot of it, if you notice, whenever I push your feet up, your knees come in.
I'm a little bow-legged. I don't know if that's related.
If it's been like that your whole life, then that's fine.
Yeah. My parents used to make fun of me for being bow-legged all day.
Yeah.
It wasn't like I needed like a brace or something like that. But
Yeah.
I'm a little naturally pigeon-toed, I guess.
So the arch support will help with that a lot. So especially with during your movements and whatnot.
Yeah. You think I should maybe just be using them in like my workout shoes, I guess?
Yeah.
The thing with squats though is I'll usually squat barefoot. Do you think I should?
Ooh.
Sorry.
Had to do it. There we go.
That was a good one. I just was not expecting it.
The toes are always the fun surprise. Yeah. So the outside of over here is what I was talking about being super tight.
Yeah.
There's
I
some
feel it
little-
connecting like all the way down to my ankle now.
Yeah.
Yeah. I like literally feel the whole like
These usually get really tight in people who do have flat arches. These are your peroneal muscles. Because whenever this collapses, it kind of brings these closer together, so they're constantly tight, or they're constantly in a shortened position, and they just get contracted and they stay that way.
That makes sense.
A lot of times inside of the foot can get tight.
Ooh, yeah. I've never even noticed that before. But new areas of tension.
People are always like, that didn't hurt before you pushed on it.
I know, right?
Well, sorry.
It probably was hurting some other way.
That's why you came here.
Bring a whole bird.
This, we call these the torture rooms.
Great.
Yeah, so we have a quad problem. Add quad stretch to the list. This is probably
Why does it hurt so bad?
your main one. People don't know how to really stretch them. Like,
That's my
most
thing. I
people
need
would
to
stretch quads
more.
like this.
Yeah.
Doesn't really do very much. So I'll show you one that's a lot better. Getting the whole muscle.
Oh man. I'm like sweating the pain out now.
Yeah.
Sheesh.
That also happens. People leave here really drenched in sweat.
This is my
Like,
workout
what do you
for
mean?
today.
I'm cold.
trying.
He hates me right now.
No, this is great. I love it.
Oh my god. We're gonna have you do this one. Hold your leg straight. Okay, just hold your leg out straight.
Okay.
Like this. There we go.
Okay.
And bend it.
Bend it.
Mm-hmm. As far as you can.
Yeah. Everybody now knows you got something visible in the middle of the training.
There we go.
Congratulations.
Alright, begin.
Again.
Yep, and bend. There we go. Alright. Okay. Let's do. Turn on. We do need to go through some glute stuff. I don't want to know if I want to torture you that much. Because we've already got it.
Oh no.
Yeah. Because it wouldn't be fun.
I definitely got tight hip action, so yeah.
I feel like I hear her complain about her SI joint a lot.
Yeah. I get like weird sciatica. Like, oh.
And
That one on
silence. Alright, let's do one more. And you're short. That's why it was weird. There we go. Now we got it.
That was a little looser.
That was better. Alright, hop up. Don't torture you anymore. A lot of people stretching like this and they're like, oh, they're not tight at all. I'm like, yeah, right.
Yeah, no, I don't feel nothing.
Yeah. So, and then I push on them and you're like, what's going on? So what we're gonna do is put your knee up in a chair like this, foot up against the back part. I want you to think about first tucking your butt. Mine are very tight as well. Tuck your butt and then try to lean back into it, keeping your butt tucked. So instead of keeping your hips kind of in this flex position, that's the main part about stretching your quads because they attach up here. So this is always flexed and you're never really getting the full stretch of the muscle. So you're gonna tuck the butt, which is gonna open up this part and then lean into it. And that's what's gonna really stretch the quads. Instead of doing like this, because I can lean all the way back like this and nothing, my quad's totally fine. As soon as I tuck my butt,
Then you feel the pull.
I'm done, yeah. Okay. So obviously I need to take some of my own advice, so we'll talk about that at a different time. So go ahead and try that.
Alright. So foot back.
Mm-hmm. And knees on the chair, yeah. You can just kind of put it a little closer to you too, just so it's not too.
Okay.
Wherever
And then
feels comfortable.
tuck. Okay, I see what you're saying. So when I tuck my
Tuck the
butt
butt and
in,
then lean
hip
kind of into
forward,
it.
and
Yep.
then kind of push back.
Mm-hmm. Always trying to kind of drive your hip through this and then lean into it. You feel that?
Mm-hmm.
Okay.
All right here.
Yes. That's what we're going for.
That's a good one.
Yeah, so that's the proper way to stretch your quads. When it comes to just doing this, it kind of, sure it gets down here, but they all attach all the way up here on the top of your pelvis. Here. Alright, so we got that, we need to stretch our calves. We can do that when we move the camera. So for all of our neck things, you just sit in a chair. For the SCM one, the one in the front of your neck, you're just gonna look away from the side you want to stretch. So if you're stretching the right, you're gonna look to the left and lean your head back this way, and you'll feel it. Because what the muscle does is turn it towards the same side that it is and flexes your neck. So you wanna turn it away from the side you're stretching and lean your head back. It'll stretch the scrotum. Okay, so try that. And it's just easier seated because people get dizzy and it just kind of a hazard when we're standing.
So stretch this side, so kind of.
Yeah, here, you want to think about looking all the way back. Okay, you feel that in this? Yeah.
Okay, just keeping my hands down on my
Mm-hmm. Yeah.
legs.
And if you want to, if it doesn't feel like it's getting enough, you can just rest this hand on top of your head. I don't want you to think about pulling,
But just kind of
rest it there. Yeah, it'll kind of help guide you back, but give it a little bit of
ease.
Got that one? Okay, so still staying seated there. Now, you're just gonna look down and turn your head this way. That's gonna stretch this trap. So for a trap, you turn your head towards the trap you are stretching. For levator scap, it's the same thing, you just turn your head away. So I always think levator away, and that'll get this tiny little muscle here. Trap is towards, and you're still kind of flexing forwards and going away. Does that make sense? You feel the difference between those two?
Yes.
This one kind of gets the deeper,
deeper.
not deeper, the trap is very superficial, but the bigger muscle, which is a much bigger muscle. But when you have your head turned away from it, you feel how your shoulder came up that time? That means you're getting the levator, because that's the one that attaches to the top of your,
Gotcha. Okay.
or that's the one that brings it out more often whenever you do this, okay? And for these, you can definitely rest your hand on your head, so if you wanna just go into it and then just kinda rest, then it'll kinda help hold it there.
Oh yeah, I definitely feel it more like in here.
Yeah.
When I come
Good.
to the hand.
Mhm.
A little more weight.
Yeah.
Nice.
So just the main difference between those two is for levator scap, you're gonna look away from the side you're stretching and go down. For trap, you're looking towards the side and go down. Okay, you're gonna stretch them two ways. So there's a superficial calf muscle, which is a big calf muscle, your gastroc, and there's a deeper one called the soleus. That one cannot be stretched. It's not stretched with your knee bent because it doesn't cross the knee. So, or it is stretched with your knee bent because it doesn't cross the knee, sorry. The knee straight, this is gonna get mostly gastroc because it comes above the knee in the back, so it attaches higher than the knee. So this adds more strain to it when the knee is straight, if that makes sense.
Okay.
With the knee bent, it takes the gastroc out, so this gives gastroc more slack, and then you can stretch the soleus better with the knee bent. So just know, you don't have to know all those details, but just know you can do it with knee straight and bent. So you're here, you're gonna kind of lean into it, knee straight, we're gonna lean into it.
Okay. I could probably use like a wall maybe instead
Yes,
of this,
that or like a
gym or
textbook
something?
or a few books stacked together, anything like that, like end of a stair.
Or you say I could do bent.
So now bend your knee, and it'll get a different muscle, so it'll be kind of a deeper one.
Oh yeah.
You feel it?
Mhm.
And scoot your foot down a little bit so your heel kind of stays on the ground. So you can scoot it back. Yeah.
Okay.
There we go.
Yeah.
So you'll kind of feel this one more in the deeper areas, kind of on the sides.
I kind of feel it like through my hamstring a little too.
Well, that too. They're all connected with the fascial line, so yours just could be that the whole back of the fascial line is tight, which I'm sure that it is. Now do one with the knee straight and see how it feels. So try to lean into it without, like, with your whole body. Yeah.
Okay.
Because you're
gotcha.
trying to, don't think about any of this kind of being what you're stretching only what's down here.
Okay.
So if you lean into it with just your upper body, you're not really putting any more stretch into it. So
Mhm.
try to lean into it with your hip.
Yeah. Okay, I definitely feel a lot
Does that
more
make
that
sense?
way. Yeah.
Okay.
Try the other side.
Straight. And think about when you're doing it, I want you to think you're leaning into it with your hip and not your chest.
Okay.
So that way it really puts the strain there, because then this
Yeah.
way it'll feel like you're kind of stretching it, but we're not really pushing through it. Yeah.
But this is kind of all aligned. And
Yeah.
kind of, gotcha. Okay. And then same with the bent.
Yep. And this one you're not going to go super far.
Yeah.
It's not like it's going to be a
More
major.
limited.
Your knee's never going to smack the wall or anything like that. It just really gets.
Kind of this under
Mhm.
area behind
Yes.
me. Yeah.
Yeah.
Definitely feel that a lot more.
Okay.
Awesome.
So all of these are things you can do for 30 seconds each, holding. Usually we say do it for 3 times 30 seconds. So that's a lot of stretching if you go through all these, but if you want to, that's good.
Or maybe I could do like some in the morning, some
Yeah.
in the evening kind
Yeah.
of thing.
I would say do it like definitely like before workout and maybe before you go to sleep a couple times, just so that way it's balanced out.